This place gave me my life back.
This place gave me strength.
This place saved my son's education.
This place helped us find peace.
This place gave me a sense of hope.
My journey with addiction definitely started in my 20s. Like everybody else, weekend warrior, went out, partied, and a little too much. And I knew that. I knew in my 20s that if I wasn't careful, my addictions would get the best of me. I had my daughter in my early 30s, so the party had ended long before that, but the drinking continued. I had a good job, I had a good career. I had, the house, 2 cars, from the outside that everybody but the people living in my house saw, everything looked together. I'd work 10 plus hours a day and get home, have my few drinks. And at that time, cooking was also my coping mechanism. It kind of kept me from going off the rails. That was my joy in life was, I worked a lot. I came home and I got to share this passion with my family. And then Christmas 2020, at the beginning of the pandemic, I got COVID and I wound up becoming a long hauler. What I had was something called peroxima. So it was an altered sense of smell, which affects your taste. Coffee smelt septic, meat smelt rotten. Eating in general had become quite a chore for me. Even being around food cooking was very trying for me. And that's unfortunately when I really dove into the bottle.
There's so many good people out there that have substance use issues that can function day to day, everyday life. When somebody, first takes that step into the recovery plan, they're vulnerable. They're scared. They don't know what to do, how to do it, and they may have tried multiple times before and have not been fully successful at it. So there's that shame that comes with that, that guilt that comes with that. My role with my clients is supporting them through that. Help navigate them through that, help them maybe be aware of what's available to them that they weren't aware of. Hotel Dieu as a whole has many services for that client and how to get them navigated through. We have wellness programs, we have assessment departments, we have referral departments, we have concurrent disorder departments. We build partnerships with other community partners, and that way there it makes us as staff and service providers aware of what's out there too.
So it was New Year's Day, 2023. I woke up quite surprised that I had missed New Year's, that it just passed me by. I looked around the bedroom and I saw decorations everywhere. There were streamers and balloons, and the party that I had been looking forward to did happen the night before. It was a party with my wife and daughter. It was going to be a good, wholesome New Year's Eve like we'd had the year before. It was a great time, streamers and bubbly drinks, and it was a great night. And I'd been looking forward to that for a long time. And I woke up and I missed the whole thing. That hit hard. That was, you can't keep doing this to yourself. You can't keep doing this to your family. I didn't want my daughter to see her father like that. And I knew I needed help.
When Rob first came into service here, he was like, okay, I know what I have to do. But I still don't, I'm not really comfortable asking for this help, but I'm going to. And his walls come down quite effortlessly when he started getting some results, feeling better about himself. Rob utilized several services here at Hotel Dieu, from the withdrawal management bedded service to me as a community counselor, to our concurrent disorder program, to our assessment department that did a referral for him to a treatment center, and then continued on with me after.
I got the opportunity to meet Dan, a wonderful human being, and I met with him weekly. So he was kind of, my anchor for quite some time of, trying to get out there in the community, trying to accept my disease. Everybody was very open, inviting. You didn't feel judged when you came here. There were people that were here to help you, and sympathized and had empathy for you. And you could see that there's something to asking for help and having that person on the other end be someone who knows where you're coming from, maybe even experienced it themselves. You feel different in this. You don't want to be different. You don't want to have this problem. So having someone that you can relate to, it helped a lot.
Putting the actual substance itself down, that's kind of the easy part, the first step, right? It's finding out why that substance was there to begin with. Let's start looking inside internally. That the substance wasn't the problem. Substance was the way you coped with what the problem was, and how can we find, a path into that problem, all problems, and start working on that. And then you don't need the medication of the substance, to deal with the pain from the actual problem.
I spent those first 9 months of sobriety, and I say that very loosely, thinking I just needed to put down the bottle. I just needed to stop drinking. If I could just stop drinking, things would be okay. And I did for a while, but things were never okay. It was just like I had a problem that I was no longer taking the medication for. I wasn't looking at what got me here. So I slowly slipped back into my own ways. The only difference now is it was a secret, which made it much worse. Now I had the shame. I won't go into too many details, but I did blow up my life at that point in about as dramatic a fashion as I could have. That night, I had reached out to Dan. It was not what I wanted to do. It sucks, because it shouldn't have been that way. I know he had high hopes. I know he felt like I was doing pretty good. And to call him and say that I had relapsed and that I was in really bad shape it was hard to do.
Rob had a setback, and he recognized it right away. And he got on that phone, and he said, Dan, I need help. And he said, you were the first person I thought to call because I trust you. And that meant the world to me. He trusted me. Met him at the front doors and told him I was proud of him, for jumping on this as quick as he could, recognizing what was going on. And he kept apologizing. I said, absolutely not. This is a good thing that you recognize this.
And I walked into the doors at withdrawal management. He was standing there, and he was standing there with open arms. And, you could tell he was, even though I didn't look good, he was happy to see me. And I was happy to see him. There's something about him that even though I feared the judgment and the shame and the remorse of coming back to him after falling off, I knew right away it wasn't there. And this time I decided I was going to embrace everything that was presented to me. I didn't want this life anymore.
He already knew what to do. He knew what to do. He just wanted to reassure himself this was the right thing to do, that what I'm doing is right, and just a little bit of more guidance. That's all I did. That's all I did was help guide him, and was somebody he could vent to say, this is what I think's going on.
I needed to accept that it wasn't just the bottle or the substance. And I learned there my problem was me. It was how I looked at myself, how I thought everybody looked at me. And I just used alcohol and drugs to mask those things, mask how I felt, feel accepted, feel wanted. And going to treatment and accepting that, you know, this is a new life. This isn't just you put down the bottle and you got sober. This is an opportunity for you to have a new life, to be happy, joyous, and free.
We all have addictions. Coffee, sweets, cigarettes, food, you know, we all have addictions. So having that as a normal conversation and you know, promoting wellness, hopefully that can start here with somebody who doesn't feel they can talk about it, and then they can teach others as well.
My relationship with my daughter is by far the biggest change. It's Friday night, and Ruby and I are laying there, we're watching a movie. And snuggled up, great night. I look over and she's got tears in her eyes. And I go, Ruby, what's wrong? Why are you crying? And she just looked at me and she's, thanks for watching the movie with me, Dad. You know, you always used to be so tired. You know, you were just so tired. And she saw the difference. She had her father. She had the guy that's doing crafts and cooking meals with her and watching movies. You know, I love my relationship with my daughter. She is my heart and joy. That's the best part of getting sober. You know, it's been a lot of hard times, a lot of second guessing. Like I said, I only have to change one thing, and that's everything. And I did.
To see him walk in here with a smile on his face, to see him text me, a picture of his 1 year sober coin. It just, that's what makes me want to be here and do this. I can retire at any time. I don't want to. I still love what I do, love coming to work. Seeing people like Rob stop in, say hi, thanks.
You know, they're not just here to get you sober, to get you physically not addicted. They're here to help you find what got you here in the first place. They're here to help you find that thing that's deep down inside you that makes you feel the way you do. We all try to hide, try to isolate, and that will be the death of us. And opening up and coming to places like this and embracing everything they say, it will save your life, and it's a pretty good life.
It was October the 12th, 2019, just before COVID had hit, and Laura and I were moving into an apartment. Laura was in the apartment and she was preparing it for us to move in. She started to not feel well, and she called our friend Matt and said that she wasn't feeling well, asked him to come and pick her up. She started to speak with a slur, so he called 911 right away. Laura ended up having a massive brain bleed of the left and right occipital lobe that required emergency surgery. She ended up having a fossa craniotomy performed, which was removing the back part of her skull to allow room for the swelling of the brain. Dr. Elishal was the doctor that performed the surgery. She was in ICU for a while. It was touch and go. We didn't know where we were going to next. We were just living day by day.
When she came, one of the big challenges was she was really new, like a really new ABI. Not a lot of time to have any chance to recover, and she had been in restraints. She was what we call like responsive behavior. She's responding to the world around her and trying to react to what's happening, but she can't properly react because her brain's been affected. And it took quite a while to get her to that adjustment period. And she probably most likely was in some sort of delirium when she first came. Which again, you have an ABI, now you have this delirium. it all these things are affecting the brain. It's like your brain's on fire. Like you had to process anything and understand what's happening. All she wanted to do was get up and try and go to where she thought she needed to go at that time.
Laura required a lot of help because she does have a tracheostomy. She also has a G-tube feed. After the surgery, there was a couple of disabilities. She does have a shake with her hand, and she uses a wheelchair, and the left part of her throat is a little paralyzed. So everything that she takes in her mouth ends up going into her lungs and not her stomach. So that's why she ended up having to get the G-tube. You've been living with it for a while now. So what does that mean? You're used to it? You're getting used to it.
We had Lori on our floor, and she had done really well. She continued to make gains physically. Even cognitively, she improved, and she started getting more and more clear to the point where she's at today.
Thinking back to when she first had physio, like right back in the beginning day, she couldn't move. She was almost paralyzed. And for a moment, I thought, I hope that this is not the way it's going to be. And now look at her.
That full journey, it's a great thing to see. Like I said, as being a nurse, you don't always see that all the time. And it's, the whole purpose of why you get in this profession is to help people.
Everybody was an amazing team here, right from the nurses, the doctors, all of the staff, even the PSWs or the nurses that were in training. Everybody helped as much as they could.
Patient-centered care is the main philosophy. It's all about the patient. It's bringing those services, bringing everyone around together to help that patient. At Hotel Dieu Grace Healthcare, you can expect that your loved one's going to be cared for. We're going to care for those functional needs. We're going to care for those cognitive needs. We're going to care for those spiritual needs. And we're going to do everything we can to help you get to where you need to go next.
They provided the ability for Laura to come home. So important. Then when she would come back on Sundays or Mondays, she was good for the rest of the week until she came back home again. So HDGH allowing us to do that was really beneficial in her recovery.
There's just something about the people here, and I think that's why a lot of people do want to work here. We're here to help you get home, and the gardens around the building, it's just a friendly, welcoming environment. It's kind of always been that way.
And we have a sense of humor, right? And I'm glad that the nurses that work here also have one, because there was sometimes that my sister would just say things right off the cuff, and I would be mortified, but that's the way she is.
I remember one day there was a disagreement between her and another team member, and the one team member was trying to help her and trying to get her moving, and she just necessarily didn't want to do it that day. So I went into the room and talked to her, and I remember she told me to off.
The nurses would roll with it, and she ended up laughing with them. They loved Laura's sense of humor, and that's one thing. If you go up on the third floor right now and ask any of the nurses, one thing that they'll remember from Laura, it's her sense of humor. And what can you do but laugh, right? It's either laugh or cry. And we've had enough of this. I'm sorry. She now has a room at the Monarch House, and it's a wonderful room, and the staff there are great as well. It's one step closer to home, and it's been a really good transition. Laura is a little happier. She has more freedom, and you have a big TV now. We got her a 55-inch, so she's got a mate there.
You have cases like Laura's where you see someone come in the way she had and leave the way she did and continue to be on a good trajectory. It is a very good feeling.
Everybody has been so supportive. It's like we've had a city around us. So I appreciate everyone here, and I thank everyone for putting up with us, because it's been a while. And we said the day that we were leaving that we were going to miss everybody, and everybody said, we hope we never see you again. And we said, we hope we never see you guys again. But we will miss you. Right, Laura? Yeah.
Right from the beginning, when Tate was kind of old enough to move around and when he was in daycare,
we started noticing some pretty aggressive behavior towards other children. And he was in in-home daycare and she was super awesome, but she was saying the same thing, that he was exceptionally challenging, that he would go after other kids, he would throw things, and his tantrums seemed to be a bit bigger than what you would see in a typical toddler. We started testing Tate when he was about 2. We wanted to attempt to rule out autism first because that's something they can look at when he was younger. And we had a full neuropsych assessment just to get an idea of where he was. He's now since had another psychoed assessment just a year ago. And the same thing, it didn't come out with any specific diagnoses with him. Tate's biggest issue is profound speech and language disability. And so a lot of his behaviors seem to have come out of that. So he would be more explosive in the way that he interacted. He is kind of an angry bear. Like, that's just who he is as a human. Like, we always joke when we're in his school meetings that he's essentially an 80-year-old sitting on a porch yelling at kids to get off the grass. Like, that is really, if you could picture him, that's pretty much his personality. Grade 1 was the most challenging. Within the first 8 days of school, they had called 6 times to pick him up. He was hiding under the desk. He had thrown things. It just was, it wasn't good. He barely was making it through full days of school. They were unable to manage his behavior. And then they started kind of also getting on board with contacting the intensive treatment program through RCC that they weren't going to be able to manage him in the school.
When I first met Tate, that was back in February of 2019. He was admitted into our classroom for aggression towards peers, towards adults. He had some impulsivity behavior. He would become fixated on issues, and he would become fixated as well on what adults have said. And he had some emotional regulation difficulties. All of this was pretty much from the school aspect, although it was a referral both from mom and from the school.
Obviously, it's a very, very emotional and challenging thing to come to terms with as a parent, that your kid isn't going to function like everyone else, that they're going to have to choose a different journey to being successful, especially when you're going into something called an intensive treatment program for your 6-year-old. We are lucky that Tate has always worked well with us at home. So this was not that he didn't have behaviors at home, but they were not the same. It wasn't peers, it wasn't demands of work, it wasn't all the sensory input that goes on within school, right? So home was always a bit more manageable. But when he came here, that transition was really tough just to come through it.
So we were able to meet with Melinda and hear just from her aspect what the difficulties were. We usually take the first month to assess the kids. We meet with a family a month after they've had been with us for about a month. And then we kind of talk about what our observations and what our assessment is thus far. Melinda was fantastic in working with us and listening to our recommendations and suggestions for treatment.
The very first day here, he gets kicked off the bus. Because the busing company isn't they're bus drivers, right? Like, for safety purposes, they're not managing behaviors, and there isn't staff assigned to the bus. So, the very first day he got kicked off the bus. I think he threw his headphones at someone. I think that was what he did the first time.
For Tate, it was, he was a sensory type of kid. Not touch so much, it was more loud noises. Kids screaming, kids yelling, swearing. He would become extremely violent, and he would become extremely aggressive towards those kids. So we really had to do one-on-one approach with him in order for his safety and for the safety of the other kids.
You sometimes question yourself about, am I failing me? Am I failing my kids? Am I failing everyone? Because I was not good with my kids or with myself. You remove yourself from your friends or your family and work. Like, you just kind of shrink because it's so overwhelming.
Tate was part of a new pilot project, and it was actually a classroom of 12. And so we actually had 2 teachers in the classroom and 4 CYWs. one of us was specifically assigned to Tate just because of his aggression level. He had a social worker assigned to him and his family, and he also had an in-home worker. He was a touchy-feely kid, so even if you were sitting beside him, he was like leading right on you. When he talked to you, he was always touching some part of us, and he always wanted to make sure he had our full attention when we chatted with him and discussed any issues he had.
Before we were able to transition into this, I was getting in trouble at work perpetually. Called in for attendance meetings, that you're not here, you're leaving frequently, all those sorts of things. So I was getting in trouble at work because they weren't able to keep him in the school. So then when Tate came to RCC, it was like an entirely different situation, because no matter what was going on, no matter what he did, all there was phone calls. I didn't have to leave work. I didn't have the anxiety every day of dropping him off and be like, oh my God, what's going to happen?
One of the strategies that we used for Tate that really worked for him was, and he kind of developed it all on his own, and we just went with it. He went with, was my day a woohoo day or was my day a boohoo day? And before he would leave for the bus, he would check in with us. Am I telling mommy it was a woohoo day, or am I telling mommy it was a boohoo day?
A turning point in Tate's progress was when all sides of that were impacting in the way Tate was learning came together. So we as a team, as a family, and as the team that saw him at home and the team in school sat down and specifically developed a program that would work with Tate. And then it's like he flipped and he flourished, and we went. And that's something that I very much appreciate over there, is they're very flexible, they're very adaptable, and that they work with each of the students that they have. It's not a one size fits all system, right?
From the Tate that was admitted to the Tate that was discharged, two totally different kids. The Tate that was admitted, like I had mentioned before, he was extremely aggressive. We could not keep our eyes off of him. He was in his own desk, kind of in his own area. And then the Tate that we discharged was an independent little fella. He was able to walk through the halls and not have to hold our hand. He was able to go do little errands for us and go drop off little notes to other teacher just to build his confidence. And yeah, when we sent him back to his community school, they were shocked.
I will tell everyone that coming to RCC saved Tate's academic career. There is nothing else that I could attribute that to.
If Melinda wouldn't have made the choice to have Tate come here and their family work with us, he might still be that aggressive kid. We were able to see his strengths, we were able to see his weaknesses, but we were able to work on them. And we were able to build on them and build on Tate's confidence and build on Tate's self-advocacy, just as his mother is a very strong one, and take that family to where they needed to be.
Think about it this way. If you find out that you have something wrong with your heart, you're not going to just stay with your family doctor, even though they're a doctor, right? Same thing in school. Teachers are teachers, right? But if you find out that you need something more and specialized, you want to go to the place where those people are trained in that special specific area.
Melinda came, I believe it was maybe 6 to 8 months after he was discharged, telling us that he had been invited to a birthday party. And that it was the first time he had ever been invited to a birthday party. Or when she came back again another time and she was like, you guys, you won't believe this. He had a play date and I didn't even have to stay. So taking a child from you could not leave his side to a child who was now attending play dates and birthday parties, like a quote unquote normal kid, right? And he was able to do that. That's huge.
Every time we drive by, he'll be like, remember when I went there? And I go, yeah, I do. He's like, can I go back? I'm like, no. He's like, can I go to high school there? I'm like, no. You actually have to, keep going through the regular school system now. And he's like, oh man, he loved being here. Again, he felt safe. And he very much connected with the staff that was here and the way that they approached him. So he definitely did love it here. What I really, really feel that's different about here than other experiences is their willingness to engage their patients and their families. They're constantly looking how to make things better for their families, and they're asking families with lived experience to help change the way that they're approaching their patients and their families. They're trying to look for that holistic approach to treating a whole person, not just their individual situation. This place has profoundly changed who I am. I'm not even the same person I was before I got here. All of my life pretty much is dictated around my experiences here and with my kids.
Joey had had leukemia for 21 years, and so every few years he would have to go in and have the chemo, and he ended up with a mass on his lungs. He was put in a clinical trial, which got rid of the mass within 12 months. The side effect was it did affect memory. Joey started showing signs of just short-term memory. In the first 3 years, not really too bad, but then it got progressively worse. When Joe left the memory floor at Seasons, he had Alzheimer's for 6 years, leukemia 21 years, and then he had 2 bladder cancers the last 3 years, diagnosed in 2019. Wouldn't use a bedpan, couldn't walk, had the walker, took 3 of us to get him into the little bathroom. And then February 1st, I said, it's time. We can't do this. We were living in LaSalle, friends in LaSalle, my family in Amherstburg, my daughter in Kingsville. And I remember thinking, close to home, and this will be better. And then I was so happy that I did, because the experience with palliative, and in those circumstances, was amazing.
Palliative care is a specialized medicine that focuses on comfort and dignity, symptom management at the end of life. The expectation is someone is in their final 3 months of life when they come to the unit. And we have some people here only for a couple of hours, some people a little bit longer, but whatever time they are here, our focus is that they're comfortable, their symptoms are managed, and they're dignified.
He was in palliative 19 days. He moved in February 1st, and I moved in with him. From the day we got there, you knew you were going to be supported in this journey. And they made you feel like you're a part of the team, but they're the ones that are giving the medical care and all of that care. They didn't just make it feel like home, they made it feel like you were in a family environment, and that probably stands out for me. You're on your time, not their time. Like in the hospital, it's their schedule. At palliative, it's your schedule. It's your needs. It's all about you, your loved one, and what's good for you in that moment.
Joe was pretty much nonverbal when he did come to our unit. So it was all communication through Susie, who led us to know Joe and how hopeful she was for her future moving forward. And it's really the thing that how much she appreciated us. Because of course, people are exhausted. When they come here, we expect nothing. We're just here to help them. And another aspect of the palliative care is that if symptoms are managed, often we see when someone comes onto our unit, a little bit of an uptick in function. Because their symptoms are managed, we're not medically managing someone. So we have some moments, not everybody, where they can have some good quality time with their family. And that's really what the focus is, that whatever time we have left, it's quality.
And given the circumstances, it could have been horrific. It wasn't. They made it loving. They made it friendly. It's amazing how they can tell when someone is getting closer to the end. They prepared me every step of the way. And they let us turn his room into like a family room where we can be with him.
I understand on this unit what the expectation is. So we know they're coming here to die. And we want to make that as peaceful, comfort, dignified as possible as we can. So during palliative care, what families need is honesty and a safe space to let it all out, to vent what experiences have been through that led them here, their worries, their fears, listening to them, letting them have their space. And then if it needs to go further, reaching out to their team members who can support certain specific concerns.
With Tracy, she has the best sense of humor, and Tracy has the ability to listen and put things in a pretty good perspective. A perspective that when I would feel at the lowest, there was always somebody to talk to. When you needed a pep talk, the nurses would come in, they could see it, and they recognized it, especially Tracy. You really felt like you became a part of a family.
I just remember how much love she had for her husband. Spent her 24/7 here, climbed in bed with him, had all their moments that they needed as he was transitioning. And his was a much more of a challenge because ups and downs, very unpredictable. She just appreciated the space that she had here, the time she had with him, but definitely just the love she had for him, the support from her family. It was very beautiful.
The morning Joey passed away, I sat with some other people explaining, it's probably going to be within a day or two. I don't know how they know, but they know. And I mean, his poor little body was disappearing. We were both sound asleep. I woke up about 10 to 5, and I do think it was probably the Holy Spirit tapping my shoulder, waking me up. And I looked at Joey, and his breathing was shallow. So I slid over and I sat on the bed. I kissed him, and I said, "It's okay." And I said, "I love you. Everybody loves you, and it's okay." And he took his last breath. I waited probably 15 minutes before I called, because I knew this would be the last time I would hold his hand. You could see everybody felt bad that he had passed, because initially when he got there, he was such a spirit for people.
I feel very fortunate and privileged to be on this unit for the last 6 years. It is such an honor to support these patients and their families through this very difficult situation. And of course, I feel our doctors are amazing. They're so compassionate, so available, so willing to teach. My nurses, I could not love anymore. And then our support team, they know it. In Hotel Do, they know this is what services provides for the community and how needed it is, and it is valued.
When you look at the whole scenario, and everybody's journey is different, dealing with terminal illness. When you look at this, it's almost you walk in and it's a blank puzzle, but it's almost like they fill in the puzzle pieces for you to get you to that final piece where you say goodbye.
At the beginning of May 5th, I actually started having some back pain, which I thought maybe I slept wrong, something was a little bit off, and didn't really think much of it. But by May 7th, I realized that it actually was more serious. I was starting to identify the pain as being nerve pain. But then the next morning on May 8th, when I got out of bed, I couldn't coordinate the movement of my feet. I could feel them. I could feel that my foot was hitting the floor, but I had no concept of where they were in three-dimensional space.
GBS, so Guillain-Barré syndrome, it's a rare autoimmune disorder, and it's essentially when the immune system attacks the peripheral nerves. So a lot of times what happens is patients experience muscle weakness, pins, needles, and numbness, and muscle paralysis.
At the point of diagnosis, I had already lost all of my mobility. The height of my paralysis would come 3 days later, when I lost all function from my axilla down, and I had lost the left side of my face had dropped.
So a lot of times what happens with GBS is that their symptoms occur first distally, so you're talking fingertips and toes, and then they work their way up the body.
So it was scary because, okay, we have a diagnosis, we have a plan, but even though I had started that, I was still declining. The uncertainty was terrifying, to tell you the truth, just because we didn't know when the paralysis was gonna stop.
And when Christy first came, her limitations were so severe. She needed a lot of help to just do the basics of rolling in bed, getting up from the bed, being able to transfer from the bed to the chair.
Going from a fully independent person to a fully dependent person, it was a very difficult transition just to give up that amount of autonomy.
Typically, when a patient first arrives here at the hospital, we go through a formal assessment, get to know our patient, talk about what they need to be able to do to get home. So what home looks like, right? Do we have stairs that we have to navigate? Is somebody at home with them? And then we go through our formal assessment of looking at different sort of areas such as strength, coordination, areas that are specific to the diagnoses and to the patient. And then from there, we talk together and say, you know, what are your goals as a patient? What do you want to work on while you're here?
When I arrived, we set functional goals. My first functional goal was to be able to stand to brush my teeth. But I was told by a physician that I would leave here in a wheelchair. And I did not accept that.
Christy, you know, was motivated from the get-go, like I had said, and so determined to push through her goals. So it was really quick to be able to then progress to the next and to the next.
And actually, they were really good at also helping me keep my own overachieving nature in check. I'm very much an input-output person. If I try this hard, I should be able to see this outcome. That wasn't working with GBS. And they helped me keep realistic goals. And they asked tough questions sometimes. Because sometimes I would say, well, I can't do this yet. And then they would redirect. Yes, but what can you do? And what did we do that we haven't been able to do before? My son had been sleeping at his grandparents', and he returned and he met me in the gym, and I went to pick him up. And at this time, I was already in a wheelchair, but I couldn't lift him.
We take those things for granted, right? We don't realize how much effort, how much energy, how much it takes to be able to do something like pick up your son. And she was just in tears.
That was truly the most devastating thing. Like, pain is one thing, I can manage pain, but that was like a milestone of losing the ability to be a mom.
Your rehab journey is such a roller coaster of emotions. There's moments of highs and lows, not only for the patient, but also their families. It takes a toll. Like, at the end of the day, this is life-changing for a lot of our patients. She's a young mom, right? And has a young little boy at home who is trying to understand everything that's going on.
My son is 6. He turned 6 in this hospital. To attest to the impact that this staff has on your journey, on his birthday, without me asking or encouraging, our nurses on their lunch breaks decorated his room to help him celebrate his birthday. He came to get on my lap, and I lifted him. The next morning when I went in to occupational therapy, my nurses had put that in my progress notes. That is the milestone that means everything to me. And it meant something to them. But for me, that was when I took myself back. When I was able to do that, they knew that that was an important part of my progress, that made it into my chart. That's a part of my medical chart, that I was able to become a parent again in the way that I wanted to be. And that was honestly my biggest rehab success.
As she started to progress through her goals, that's when we started to further challenge those goals. You know, I remember once we were starting to be able to transfer independently, it was okay, let's progress this from here. So it was, you know, being able to stand for 1 minute with support. So holding onto a counter, holding onto our neuro gym. And then from there it was, okay, let's try 2 minutes.
I stood with her and I immediately sat back down. And this point I was still in a wheelchair and I was just using this as a poultice stand. And she thought I injured myself because my eyes just like opened beyond belief. She's like, what's wrong? I'm like, I felt my feet. And she's like, what? I'm like, I felt my feet. And that was the first time I felt my feet underneath me. Before I would have to look down and move my feet to where I needed to position them safely. But I felt my feet. And it was mind-boggling, thrilling, but like startling as well because it was totally unexpected. It just turned back on.
Patience is so important, especially like GBS. Like, it takes time. It doesn't happen or change overnight. And a lot of times people can get frustrated, right? I was doing this before. This was always so easy. Things might be different when you leave here than what they were a year ago. And sometimes it becomes a new norm, whether it's a temporary norm or a more long-term norm. But I think it's so important for patients, you know, to realize and think back to how far they've come.
Being mindful of those milestones that are unseen by others, but are huge building blocks to getting where I needed to be. But also they were really helpful in helping me not push myself to the point where I was discouraged by my lack of progress, when really there was progress all along.
It's so great to work for a healthcare facility that's values align with my own professional values. And I feel like beyond, you know, within these walls of, you know, a great team, interdisciplinary team, such great therapists, it is such a team approach, and we really feed and grow off of each other. I like to say it's super collaborative, between every discipline that you could possibly name. Everybody's involved and works so closely to help our patients work towards their goals of essentially going home or whatever that goal may be.
It is truly a holistic experience. Like, every aspect of your recovery is touched by so many hands that you can't undervalue the contribution of this program. Like, I could attest to the rehab program and the nursing staff that support me, but it is everyone. It is the dietary staff who remember that, like, oh, she really doesn't like the pears. We're gonna make sure she gets the orange today if I was out of the room when they took the menu. They remember that your kid had a baseball game and how did that go? Everyone here really is attuned to your needs as a person and not just as a patient, because you're here as a full-time inpatient and this is your life while you're here. I feel like, honestly, some of them feel like family, and there's no way that you can thank these people from walking you through these like very unprecedented times. How else could you do this? You couldn't do this without everyone here in your corner, and they are.
It leaves you speechless, really, at the end of the day. I mean, Christy going from being a 2-person to transfer to walking in here with nothing, doing flights of stairs like it is nothing, is so great to see. And I'll still remember when Christy walked down the hallway and was so excited, glowing, and talking about how she couldn't wait to go trick-or-treating with Drew. And we can give patients the tools to do what they are, working towards doing, but ultimately it's the patient, right? Like, they're the ones showing up every day, and they're the ones giving 110%, and they're the ones that say, okay, another set. So I feel like, we can give those tools to somebody like Christy or any of our patients, but it's ultimately, they take those tools and then they run with it.
Alexis was the only person who is consistently with me for my whole 10-week journey. How do you ever thank the person who has given you the ability to walk? You can't. I have photos and videos from that time, and in all of them, it's her by my side every single time. That gave me back independence. That gave me back control of my own life. She had faith in me that I was able to do it based on the skills that I'd shown her, and I had to have faith in her because it's a leap of faith in the truest sense, and we made it happen.
It's a constant reminder of, why we do what we do. I'm so lucky to come to work every day and be able to help people like Christy work towards their goals. And, as small as her goal was initially of just being able to transfer by herself, to be able to pick Drew up, to her walking around here with nothing, walking up the stairs, going shopping at Costco, it's just so great. And it's, like I said, a reminder of why I went into what I do and why I love what I get to do every day.
Hotel Dieu Grace Healthcare was where I needed to be in truly my darkest hours. There is no other program where you could be immersed to the degree that you are, particularly in the TAFOR program. There is no way, 9 months out, back to work, taking care of my family, actively involved in my formal life, without having had the opportunity to have the intense, and I do mean intense, programming that they offer here. It's never pushing you beyond what you can handle, but it is pushing you to the point that you need to achieve your goals. No 2 stroke patients are the same. No 2 GBS patients are the same. No 2 traumatic brain injuries are the same. And they take that into consideration. You're an individual here. You're not a GBS patient. You're not your diagnosis. You're the person who they're fine-tuning a program for to make sure that when you leave here, you're leaving here the best version that you can be. I don't know of any program like this anywhere else. I know our city and our county doesn't offer anything similar to this. In acute care, it is not designed for this type of support. This is an essential program to bringing so many people back to their own autonomy, their own dignity. There's a big aspect of reclaiming dignity while working through this program. It is not straightforward, it's complex. This is complex care. These are complex patients. They respect that. You're treated with respect.